1973, Alice and John Tyler founded the Tyler Prize for Environmental Achievement. In its 49-year history, an array of changemakers from environmental science, policy, and economics have been awarded for their contributions to protecting our planet. As humanity grapples with ever more perilous challenges, the Tyler Prize has this year recognized a pioneer in the new field of planetary health. This year's laureate is a physician bold enough to sound the alarm on the dangers climate change poses to human health, and determined enough to fight for solutions across 3 decades of interdisciplinary research and global leadership. The work of Sir Andy Haines has been both a wake-up call and a rallying cry for humanity.
For the longest time, climate change was seen to be an area of work where climate scientists indulged in. People could not take the science of climate change to everyday effects in people's lives.
For too long, maybe we have been focusing on polar bears, on glaciers, on planets, and that sounds a little bit distant for people.
I saw how environmental changes were affecting human health, both changes in the social and natural environment, and I realized that something had to be done. It became increasingly apparent that we need data in order to convince politicians and other decision makers to act. And so I decided to publish, to draw attention of the public and the profession to the problems.
And it was Andy Haines who wrote the first papers that identified climate change as a serious risk for public health. And it was really not accepted for a long time.
After decades of rigorous research and landmark publications in leading journals, Sir Andy's work began to influence global policymakers.
Now today we recognize that climate change is mainstream for public health.
It's so important for us to collect the best scientific evidence because we want politicians to say, okay, I'm taking action because I have the scientific evidence.
The WHO assessment Sir Andy Haines co-edited became really an important document because it started to really unravel the real impact on people's health and lives.
His seminal series of papers in the medical journal, The Lancet, outlined all of the ways that climate change poses serious risks to our health.
It mobilized a lot of health practitioners when they see it on The Lancet, this very clear message about how climate change was a major public health crisis.
Andy was among the first to come up with the concept of planetary health.
Planetary health redefined medical science. Instead of focusing solely within the human body, planetary health looked at health more broadly, building on the work of Sir Andy Haines to include the systems that sustain human life.
We felt that that was a very powerful way of communicating the need for action to policymakers.
Unless we address planetary health and make this a priority, we will always be trying to catch up with the way the world is unfolding, with more crises, with more pandemics, with more disasters, and more suffering for everyone.
So Andy has been out front at the cutting edge, looking at how there are enormous health benefits to be gained if we get to a low-carbon economy when we look at policy actions to fight climate change. And it is for these reasons that the Tyler Prize Committee has decided to recognize Sir Andy Haines this year.
Winning the Tyler Prize will, I think, help me to continue and hopefully even scale up the work that I've been doing with many colleagues, and also help to amplify the messages that we're trying to communicate about not just the risks, but also the benefits of decisive action.
Sir Andy deserves the Tyler Prize because he has been one of the key contributors to climate change and health, providing the scientific evidence that allow us now to move on very strong recommendations.
I always think it's important to maintain hope, both in medicine, when you're working with individual patients, but also when we're thinking about the population and about the planet. So it's imperative that we keep going, and I intend to do that as long as I can.